Hello and welcome to our wellness workshop. Thank you for taking the time out of your busy schedule to join us today. I'll start our meeting with a little background. Mind Plus Neurology is a headache and migraine clinic with 2 locations in Wisconsin, one in Mequon, and the other is up in Appleton, Wisconsin. And my name is Tracy Bryce. I'm the Director of Marketing here at Mind Plus Neurology, and I'm pleased to welcome our guest host, Alyson Lippman. Alyson is a nationally board certified menopause provider and certified nurse midwife with nearly 20 years of experience in women's healthcare. And today, Alyson will be talking about the relationship between hormones and headache. And with that, go ahead and take it away, Alyson.
Yeah. All right. Absolutely. Thank you. Thanks everybody for being here on your lunch break or lunch hour or whatever is going on. My name is Alyson. I have, like Tracy said, I've been working in women's health a long time and spent the last few years delving more into hormones, hormone health, midlife, menopause, perimenopause, all of those things. And so that is, I am certified through the Menopause Society and also certified hormone therapy provider through Heather Hirsch Academy. And I am also a migraine sufferer and headache sufferer. So I feel it right along with you guys. I get migraine with aura, which is an interesting one because a lot of times that condition is left out of research. So they don't actually know all of the answers. But today I want to talk a little bit we'll talk some about hormones and then in general, and like sort of physiological changes that happen with the menstrual cycle and with perimenopause and menopause, and then we'll talk about the connection to headaches as well. So this is me in my office. I know somebody had asked right at the beginning if I see patients. I do see patients in my office. I'm located in Shorewood. I can do telehealth as well throughout the state of Wisconsin. And I provide comprehensive women's health care to women in midlife through menopause. I do have some patients that are younger who are looking to optimize hormones for a variety of reasons, maybe PCOS or looking for fertility, things like that. But for the most part, I work with people in midlife through menopause. And my appointments are an hour long. So we talk through not just hormones, but also any supplements, medications, diet, exercise, mood, sleep, and kind of anything else that's going on, sexual health, anything that's going on in people's lives. And I feel that that's really important because we can't take the midlife out of the woman, right? There's a lot going on in our lives. And then also we have a variety of things going on, stress, things that affect hormones, and then hormones that affect other things in our lives, including headaches. There's something else I wanted to say and I forgot it. So I'm just going to keep going. So I know that the stuff on the left is not new to probably anybody on this discussion. So there are these types of headaches. Those are just sort of broad. And there's a variety of causes. We look at stress, medications, sleep, and then are there other things that are going on in the body? So diabetes, high blood pressure, any other pathologies. Sometimes thyroid affects headaches. And so the reason that I talk about these things is that these things affect both headaches and hormones. So in that causes column, we're looking at the sort of dual effects of those things. And sometimes there are also unknown reasons, or for a lot of us, unknown reasons or triggers for headaches. And then diet, exercise, water, stress, sleep, and hormones can have a big impact. So I want to talk a little bit about cyclic headaches. these can start anytime in life. So sometimes young girls in their first periods experience headaches. Sometimes these don't happen until later in life. I did not start getting, I always suffered from headaches. I didn't start getting migraines until I was 35, about 6 months after my second child was born. For me, I don't know that there is a menstrual or a cyclic nature to my experience, but for a lot of people, there is a cyclic nature to it. And so the important part of this diagram here is that hormones, your sort of most significant hormone related organ is the brain. So everything starts in the brain. The signals from hormones go to the brain, and there's this feedback loop back out to the ovaries and to the adrenal glands that produce hormones. And in a regular cycle, you can see there's that sort of spike of FSH and LH right in the middle of the cycle. So sometimes there are headaches that happen right around the time of ovulation. And even somebody with a hysterectomy with the ovaries still intact might notice those kinds of cyclic changes. And then if you look down to where it says blood levels of estrogen, you can see that there's that estrogen spike just before ovulation, and then a rapid drop right around the time of ovulation. And then if you look a little bit further out, there's another rapid drop of both estrogen and progesterone that triggers a menstrual period. And so with those hormonal fluctuations, that's where we start to develop cyclic symptoms. And that might include GI symptoms. It might include like uterine symptoms like cramping, or if there's any endometriosis or uterine tissue outside of the uterus, that can happen as well. Knowing that the brain is the biggest center for hormone signaling, there are mood changes, and then that's also where headaches can develop. And so initially, when we start thinking about hormones and headaches, we think not just about menopause and what's happening at the end of having cycles, but what is happening with these cyclic changes. And then if you are someone who's in midlife, maybe even in your late 30s, early 40s, and moving closer to perimenopause, there's a lot of fluctuation with hormones that affects headaches as well. And so when we think about treating cyclic headaches, there are non-prescription medications like Advil and Tylenol. There are several prescription medications, caffeine, sleep, certainly activity contributes, as well as hydration. And then over on the other side, I'm not going to read everything to you, but the one down at the bottom is hormone control. And so typically when someone is younger and of reproductive age, that hormone control is often in the form of birth control pills. And so that's something that you might hear doctors suggest. And now more and more birth control pills are used not just cyclically, but people skip those placebo pills and take those pills continuously to try to sort of, if we go back to that picture, what it does is it turns off the any fluctuation related to FSH or LH or estrogen or progesterone. So all of those lines, rather than having any waves, are going to be completely flat. And there are pluses and minuses to doing that. The purpose of the birth control pill is birth control, and not everybody feels better or comfortable with completely sort of causing a neutral effect on hormones that way. But that is one thing that can help in terms of hormone control. In menopause and perimenopause, we also talk about using menopause hormone therapy. So that means not birth control but using estrogen and progesterone in a different form. So you may have heard the word bioidentical, which I don't love because it's really sort of a marketing term. But bioidentical truly just means that the main ingredient is a plant-derived version of whatever hormone is being made in your body. So in this case, we're talking about estradiol as the most significant or sort of the strongest and most prevalent estrogen in the body, as well as progesterone in the form of prometrium, which is a medication. I will talk more about both of those. But we can use menopause hormone therapy in perimenopause or menopause rather than birth control pills. And that does not completely shut the system down, but what it does is it provides sort of a more even base. So thinking if you're on Instagram, you might know Mary Claire Haver. That's her. She talks a lot about menopause and perimenopause on Instagram. But when we think about hormone control and the cycle, a woman starts with a lot of ovarian follicles, so that's eggs on the ovary, and then that decreases rapidly as hormones as we move closer to perimenopause and menopause. So there are two sort of different ideas, right? There is this, it's all hormonal. You should definitely work with hormones. And then there's this idea that you shouldn't take them at all. And I like to be a little bit more in the middle and to think about doing what works best for the individual. So looking at it's not hormonal. So I put birth control pills in this section, thinking about it more as like a medication, but that is hormonal control. And then we also think about, working with headaches, working with like perimenopause and menopause, that you can use birth control pills to keep everything neutral, that you can use diet and exercise to help with sort of supporting hormone health. And we know that that often means increasing protein intake, eating lots of vegetables. And for those of us with headache, not engaging in like sort of intermittent fasting or significant calorie reduction, unless there's a weight or diabetes component to it. And then there are also supplements that can be supportive of hormone health. Sometimes I say that hormones, like the word bioidentical, supplements are good marketing. So you might find somebody who says that they started taking something and they felt so much better. And if you find something that makes you feel amazing, you should stick with it. But for the most part, we know that there are certain supplements that are really great and supportive of hormone health, and that there are others that either don't do anything or can kind of interfere in ways that we don't want them to. Other ways to work with hormones are to work with symptoms related to hormones. So medications, antidepressants, ADHD medications, gabapentin for pain, trazodone for mood and for sleep. So we do sometimes use other medications rather than hormone therapy, but we know that hormone therapy can kind of take over the role of what a lot of those things are doing. And so when I talk about hormones, I'm talking predominantly about estrogen, progesterone, and testosterone. Estrogen is our main culprit when it comes to cyclic headaches, in that when the estrogen drops dramatically, that's where a lot of where a lot of those symptoms come from. But we also do see effects related to progesterone and also related to testosterone. We hear a lot also about cortisol. And cortisol is elevated when in times of stress. The adrenals don't tire out in a way that they will stop producing cortisol. If there is an adrenal pathology, that's something that could happen. But the adrenals will continue working, producing cortisol, producing a low level of testosterone throughout. And there's so much talk right now about weight-related hormones as well, including the GLP-1s. And so those are actually digestive hormones that naturally occur in your body that we are giving exogenously, like from outside the body. And interestingly, when we use the sort of like female sex hormones, for lack of a better term, estrogen, progesterone, and testosterone, when we use those, stopping those is possible. Your body would go back to whatever your normal level was, whereas weight-related hormones do change the ongoing feedback loop in the body, and so not quite as easy to stop. So I have these pictures up here because in perimenopause, so if you look on the left, you can see this sort of menopause journey. And so even though we looked at when you zoom in on those, the diagram of hormones during the menstrual cycle, it looks like there are these big ups and downs. But really, it's pretty stable throughout life. There are these predictable fluctuations. And then if you look at sort of between the number 1 and the number 2, estrogen is fluctuates considerably. So it goes up and down, up and down. And if you look at the picture on the right, I know that looks kind of confusing, but what that's showing is that the brain in perimenopause is telling the body, like, come on, produce estrogen. We don't want you to stop. And the ovaries, which because there are fewer follicles, are the ovaries start to decrease in how much estrogen is produced. And so the brain is giving extra signal to the ovaries saying, come on, give us more, give us more. And sometimes the ovaries are like, yeah, no, not today. Not going to do that. And so that's where those really low dips are. And sometimes the ovaries say, yeah, okay, no problem. Here's your normal amount. But because the brain is giving those signals to increase estrogen so greatly, sometimes there's even a further increase in estrogen, so that the fluctuation is far above normal and far below normal. So that can be implicated in more headaches or less predictable headaches in the time of perimenopause. And then if you look between number 2 and number 3, that's where menopause happens, where there's no longer this great fluctuation, and that the ovaries no longer produce estrogen. And so that comes all the way down to 0. And when that happens, some people, if you are someone who always experienced cyclic headaches, that will improve after the cycles stop. For some people with sort of unpredictable headaches or with migraines, those also improve after periods stop, after the body stops producing estrogen. There is a subset of people whose headaches get worse, or sometimes the headaches are different in nature, maybe moving from migraine to more of a tension headache. And so when we use hormone therapy, we give in perimenopause, when there's that fluctuation, what we're doing with hormone therapy is bringing up the baseline so that the fluctuation from up to down isn't quite so great. It's a smaller amount of fluctuation. In menopause, we use hormone therapy to raise that base level because we know that it helps with a lot of different symptoms, not just like hot flashes and night sweats, but also with sleep, with anxiety, with joint pain. We know that it's protective of the bones. We know there's some cardiac protection as well. And so when we use hormones after menopause, like I had mentioned, sometimes, or even in the absence of hormones, sometimes migraines just change. And research shows that that when we use hormone therapy, 50% of people feel better when it comes to headaches, and 50% of people feel worse. It's kind of, well, which one are you? Are you going to feel better with this hormone stability or help, or is it going to make you feel worse, especially if you're someone where estrogen causes or contributes to headaches when it's at a higher level. And sort of the only way to know in this menopause or perimenopause time is to try. And then the picture all the way on the right, I couldn't get myself to put an aura related picture, but like I had said, there isn't a lot of research on migraine with aura. So in some sort of expert guidelines, the recommendation is to proceed with caution in migraine with aura when using hormones. One plus, though, is that part of that sort of unknown risk has to do with blood clotting or stroke risk, because we know that having that migraine with aura increases the risk for stroke. And for oral dosing of estrogen, there is also a small increased risk for stroke. But I work with transdermal, so through the skin formulations, which does not increase stroke risk. So preliminary research shows that there is no increased risk of stroke even in patients with migraine with aura. And so that's super helpful in thinking about formulation of estrogen in terms of using a patch or a gel or spray rather than oral dosing. So when it comes to estrogen, these are the diagram on the right shows all the different body systems that are affected that have estrogen receptors. So I know it might seem surprising to see that there are estrogen receptors pretty much all over the body, and that includes in the brain, it includes in the heart, bones, joints, cartilage, GI system. So estrogen does affect a lot. And when body systems are in flux, especially during perimenopause or where that estrogen decreases considerably in menopause, all of these systems are affected. And that does include the brain and headaches. So when we are looking at symptoms, we look at, is it perimenopause? Is it menopause? Is there something else going on? And that's where working with Mind Plus with your headache professionals, and if this is your time of life, maybe working with a menopause specialist like myself as well, can kind of bring those things together so that you can differentiate, is what's going on with me hormonal? And that requiring a different type of treatment, or is it not hormonal? Or I'm sorry, is it hormonal requiring hormonal treatment or not hormonal requiring other types of treatment? And And so we use, these are all symptoms that can happen during perimenopause and menopause. And I put these here because these are all symptoms that can also affect headaches. And so we know that supporting our hormonal health can help with weight gain, with mood, with sleep and fatigue. Hot flashes and night sweats is an interesting one because we think about that as being very temperature related, and it is, of course, but there is also a cardiovascular component that happens when those hot flashes happen. So sometimes people report feeling palpitations or a little nausea or a little bit dizzy when they get those flushes. And that's because there is this like vascular effect as well. And so that can also affect headaches if we think about certain types of headaches being vascular, as well as thinking about blood pressure. And so we know that there's this tie related to like these conditions and symptoms of hormonal change that then also contribute to headache. So what we can do, the things on the left are the things that I always work with patients on. So we do look at hormones, but we also talk through everything that someone is experiencing in the at that time, and then how we can sort of optimize hormones and get people feeling better. And typically when things are better hormonally, we're better able to support all of our body systems, headaches included. So on the right, where if you're doing everything the same, I often get people in my office who say, well, this has changed. I'm doing the same thing I've always done. Why is it different now? And sometimes the answer is that we need to get out of that doing the same thing we've always done. Add in rather than take out. That's like sort of a general philosophy. I know that sometimes someone will say, well, like, well, you get more headaches because you're stressed. And I'm like, well, how am I supposed to de-stress? Do I get rid of my family? Do I get rid of my job? So really the idea of adding things in rather than taking things out, adding in things that bring you joy, adding in moments of mindfulness and deep breathing, things like that. The connection of diet and activity to hormone, headache. There's, I think of it almost as like a triangle. Everything affects everything else. Sleep is so key, and sleep can be really off when there are hormonal changes. And so making sure that we can stabilize sleep in order to, and sometimes using hormones to help with sleep, help with headaches. I already talked about mindfulness. And then down at the bottom, I had put down, if it works, it works. And if it doesn't, it doesn't. So sort of like with supplements, if something's not working, let's take it out and try something else. So this is just my information that I wanted to provide to you. I do little like sort of health updates every Monday on Instagram and Facebook called Menopause Monday. That's my website. And I do provide a free virtual 10-minute meet and greet. If you are wondering if this type of hormonal help might help with anything that you're feeling in general. And I know today we're talking specifically about headaches. And so how can sort of optimizing hormone health in order to feel better affect headache health as well. So it looks like I did leave a little bit of time for questions, and I am happy to answer any questions that anyone might have.
I have a question.
Yeah.
So what about like lab tests?
Mm-hmm.
Is there anything that you can do that proves that hormones may be out of balance or something like that?
That's a great question. So I don't always use labs to work when I work with hormones because typically, because trust your symptoms. So if you tell me that you're having certain symptoms, depending on what's going on, I can assess whether it's just sort of by knowledge of symptoms, whether it's related to estrogen or progesterone or sometimes testosterone. Sometimes people are curious about hormone levels, and I'm certainly not opposed to looking at them. In menopause, we know that your estrogen is going to be very low. And progesterone will be low, not as low. And so it's not, it doesn't give us a lot of information. In perimenopause, it's a snapshot. It gives us just a moment in time. And like you saw, there are those great fluctuations that happen. And so it's just a sort of a moment in time, especially if someone's still having periods or regular periods. We would expect labs to actually look normal. So it's really symptom driven. And then we can titrate based on, is there symptom improvement, and is there, or are there any side effects that we would want to then come down lower? The other thing I will say though, in terms of labs, is that I do try to make sure that people if we're working with hormones, that we know that thyroid is normal before we get started. So usually people have that from another setting, a primary care provider or something like that, because fixing thyroid is really helpful at the beginning. Looks like Liliana has a question.
Hi, yeah, you're throwing me off. It's actually my daughter's account, so I don't. I was like, "Who's Liliana?"
Oh my gosh!
You mentioned supplements, and do you have like a general list of supplements you recommend, or is that really like person by person specific?
It's pretty individualized. Overall, I say probably vitamin D, because we live in Milwaukee, and especially moving into winter, vitamin D super helpful. Sometimes, kind of depending on the individual, we often talk about magnesium. Magnesium oxide helps with GI, like if there's any constipation. Magnesium glycinate helps with sleep. And so kind of figuring out which one works the best. I do like omega-3s, either in like a supplement or in just putting flax seeds in, like on whatever you're eating, something like that. Other than that, it's pretty individual. Sometimes I'll look at like vitamin related labs occasionally, but usually we'll just kind of see how people are feeling and what's going on, to kind of determine that.
Okay, thanks.
Yeah. Other questions?
I
Yeah,
have a
Kristen.
question. Oh, sorry.
Yes, I'm interested in having someone look at my hormones and how they affect my migraines, but I find I live up in West Bend, so sometimes it's hard to see providers down in Milwaukee. You don't happen to know of anyone who specializes this up in this area?
I actually don't. In fact, I get people from a pretty wide radius. However, I can work with telehealth. So you can schedule a virtual appointment with me instead of an in-person appointment. If you're close enough, I would love to have the first appointment in person. But if you're further away, then that's okay too. And then if we did any labs, I could order it to whatever lab, either like LabCorp or Quest, or if you have like a freighter location near you or something like that, I can order labs to those places.
Okay, thanks. Yeah, I actually get down to Shorewood somewhat regularly because my daughter's a student down there. So, and the virtual option is really nice. So thank you.
Absolutely. Yeah, thanks. Sarah.
I hope I asked this the right way. I'm not quite sure. So first, like I get aura with my migraines. So I've always been told I cannot take hormones because of the risk of stroke. So for somebody who's like, I will be 47 in like a month, definitely at least perimenopausal. Like how can we work with something like that?
So that, like I mentioned, Unfortunately, migraine with aura patients are taken out of a lot of research.
Mhm.
However, we know that the stroke risk from estrogen is removed when we use transdermal. So either a patch or a gel or a cream rather than an oral. The oral travels through the liver, and that's where that clot risk comes from. And so with any condition, including migraine with aura, we weigh risk and benefit. I definitely have patients who are like, I'm way too miserable. I can't live without the hormone therapy. And then there are others where we look more at, well, how can we use maybe some supplements or herbs to support hormones without directly using hormones. And I'll tell you too that I don't go to Mind Plus because of my insurance, but I was there and we were working on it. But the doctor that I saw most recently said the same kind of thing, like absolutely no estrogen. And I was like, and I think it's less that it's really that's the issue, and more that a neurologist is a neurologist and they're a specialist in that area of health and haven't read the most recent research on menopause. So, if I'm so inclined, maybe I'll put some research articles together and provide them to her. But for the most part, it's not that they're trying not to know about it, but there's just so much better and newer research because for a long time there was not great menopause research, or ridiculously, menopause research was done on men.
Oh my gosh.
I know.
That was a great answer. Thank you.
Absolutely. Other questions? Well, this went super fast. I really appreciate everybody's attention. And if there is anything that I can do for anyone to help, like I said, I do those free 10-minute meet and greets. So if you're wondering, like, is this the right care for me? I'm happy to meet with you to help us figure it out.
And I did put the link to your website in the chat if anybody wants to access that. So it's midwifemke.com.
Well, thank you.
Yeah, absolutely. Thanks. Hope everybody learned a little something.
A lot of something for sure. Thank you, Alyson. Thank you so much. And thank you everybody for coming. Really appreciate you taking the time out of your day.